What is hyperkalemia treatment, and how does it work in kidneys? Imagine your body as a finely tuned machine where balance is everything. One key part of this balance is potassium, a mineral that helps your muscles, nerves, and heart work properly. But when potassium levels get too high in your blood, it can cause serious heart problems. That's where hyperkalemia treatment comes in, especially for people with kidney issues. Your kidneys play a big role in keeping potassium levels in check. They filter your blood and help remove excess potassium through urine. Normally, potassium is filtered by the kidneys, reabsorbed earlier in the nephron, and then secreted into the urine in the distal parts of the nephron, like the distal convoluted tubule and collecting duct. This process is controlled by hormones like aldosterone, which tell the kidneys to excrete more potassium when needed. Factors like sodium delivery to these parts and the activity of specific channels and pumps help regulate this process. In people with chronic kidney disease, or CKD, the kidneys gradually lose their ability to excrete potassium effectively. As kidney function declines, especially when the glomerular filtration rate drops below about 10 to 15 milliliters per minute, potassium can start to build up in the blood. The remaining healthy nephrons try to compensate by increasing their potassium secretion, but this is often not enough to prevent hyperkalemia. Treating high potassium levels involves several strategies. First, reducing potassium intake through diet is essential. This means limiting foods high in potassium like bananas, oranges, and potatoes. Second, medications can help shift potassium from the blood into cells temporarily. For example, insulin combined with glucose helps move potassium into cells, and beta-2 agonists like albuterol can do the same. If there is acidosis, sodium bicarbonate may be used to help correct the pH and promote potassium movement into cells. To remove excess potassium from the body, doctors may prescribe diuretics such as loop or thiazide diuretics. These increase urine flow and sodium delivery to the distal nephron, encouraging the kidneys to excrete more potassium. When kidney function is severely impaired, potassium binders like patiromer or sodium zirconium cyclosilicate are often used. These medications work by binding potassium in the gastrointestinal tract, which helps increase its elimination through feces. In emergency situations, dialysis may be necessary to directly remove potassium from the blood. Managing underlying issues is also important. For example, correcting metabolic acidosis or stopping medications that impair potassium excretion, like certain blood pressure drugs, can help control levels. In people with kidney disease or kidney cancer, careful monitoring and tailored treatment plans are vital to prevent dangerous heart rhythms caused by high potassium. Overall, hyperkalemia treatment focuses on stabilizing the heart, moving potassium into cells temporarily, and enhancing its removal from the body. When kidney function is compromised, reliance on gut binders or dialysis becomes necessary. Always remember, managing potassium levels is a delicate process that requires professional guidance. If you have kidney disease or are at risk, consult your healthcare provider for personalized advice. Proper management helps protect your heart and supports your overall kidney health.